Bear with us a minute. I'll give you a thumbs up when we're ready to go. Okay, we are live.
Okay, good evening and welcome. This is the meeting of the Town of Northborough Board of Health for September 20th, 2022. 6 o'clock. My name is Glenn French. I chair the meeting for the evening. And first, we'll start with roll call and then go into the spiel. All right. Dilip Jain. I don't think he's in this evening. Swati Sane.
Present.
Good evening, Swati.
Good evening.
Lisa Johnson.
Present.
Good evening, Lisa.
Good evening.
And Teresa Capabianco.
Present.
Good evening, Teresa.
Good evening, everyone.
And excellent. Okay, we're going to hear from Ms. Black regarding the governor's input on public hearings. So, Ms. Black,
Okay.
please take it away.
Okay, great. Thank you. This meeting of the Northborough Board of Health is being conducted remotely consistent with Governor Baker's order of June 16, 2021, an act relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the Northborough Board of Health are allowed and encouraged to participate remotely. The order allows the Northborough Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to Northborough Remote Meetings on YouTube via the link listed in the agenda. Ensuring public's access does not ensure public participation unless such participation is required by law. So this meeting will not feature public comment. Thank you, Mr. Chair.
Okay, thank you. Let's see, we're going to go right to the meeting agenda. We're going to skip over the approval of the minutes from July 19th and the second ones, the first ones, only because I wasn't at one of the meetings and Dr. Jane isn't here. So I don't think we can approve the meeting minutes or not. Or as long as we have a quorum, we can approve them. Let's put
As
them
long as, yeah, I think as long as we have a quorum in attendance from those meetings. Do you have those pulled up right in front of you, Katie? Or they're in the attached email. I don't know if you look at the.
Yeah, the one from July 19th. That's the one I wasn't at. However, we have three members of the board who were there.
Mhm.
And then we have June 14th. We also have 3 members of the board who are at the June 14th one. So we can address those. Do we have, is there anyone waiting, Kristen? Or is this just
Nope.
all administrative stuff? Okay.
All administrative. Our first item on the posted agenda, the application of the Title V installer license. There was an error in the name. Actually, that individual has not officially filed for their license, so we'll skip over that agenda item. So no anticipation of any presenters or the public joining the webinar.
Check. Number 2, we've got appointment of Kevin Duquette as the agent for the tobacco compliance checks. Do we have a previous agent for the tobacco compliance checks? I
That
know he
name-
used to be heavily involved.
Yeah, that name may ring a bell. So we did have some support from Kevin Duquette in 2020. It was for the thick of COVID, and it was talked about. We went back to those meeting minutes. I think it was December 2020. So back then, the Mass Health Officer Association, MHOA, they have a contract or a grant through the state to help support local boards of health with tobacco compliance. And so through that, they were able to hire Kevin, and he did come in and do some educational visits and some compliance checks. Actually, I want to say I don't believe they did underage because it was COVID and hiring teens to go into that sort of situation was not occurring. But this year we should be able to have a whole full suite of, the visits with the support of Kevin, if the board so chooses to appoint him as agent. Going back, I don't think, although we discussed it, we never fully appointed Kevin Duquette as the agent. Kevin works in several other communities as part of different tobacco control compliant associations or affiliations. So he's experienced with this. He did help us a bit in 2020, but procedurally to move forward, there'd be no cost to the town. MHOA, provides this service. They are phasing it out. So the one thing that's happened, and Glenn or Swati, maybe you can fill us in, there was a time when we belonged to a tobacco collaborative, and I believe it may have been Leominster was a tobacco collaborative. So I inquired with our other boards of health in our greater boroughs region, and I believe Westboro is part of Leominster, and Southboro is part of a Framingham or a Metro West tobacco control collaborative. But for some reason, Northborough just was dropped. And so
I think we might have been out of Worcester.
Okay. So I think over the
Yeah.
years, the state funds the collaboratives, they provide the funding, and then they have like a compliance person. So right now we're sort of in limbo. So again, this is sort of a Band-Aid where MHOA has some funding and they're willing to contract with Kevin for him to help with our 14 licensed tobacco establishments in town. But I am hoping to have a long-term solution. So this wouldn't be like an annual different name, different face.
Right.
I am going to inquire with Framingham to see if we can join their tobacco collaborative, and it just has one inspector or two inspectors under it. So we'll hopefully build some more sustainability over time. But for the sake of this year, it's great. MHOA is offering this assistance for us. So this is where the individual will go in as the agent. They'll check all the signage, make sure it's correct, make sure, there's no flavored products or anything like that. But it's an individual who, does this full time or is contracted to do this specific work in the region. So I'm very supportive of it. MHOA recommends Kevin. He's done this for quite some time, and I think it would be a great asset to the town.
I think Northborough just had such a sterling passing rate for these compliance checks that they just dropped us off. I feel they give everybody else a chance to catch up, and so, it's good to have him back. Now, is he out of Leominster? Is that a collaborative or?
No, I don't. I think he officially just contracted with MHOA to provide sort of one-off checks for different communities. So we wouldn't be joining a collaborative. We wouldn't be able to request to join a collaborative. That grant cycle is going to hopefully appear sometime this fall. So I am following that, and I think partnering out of Framingham makes the most sense to me. And then Southboro speaks very highly of the collaborative, the Metro West collaborative that they're part of. So that's the plan long term for the sake of today, and to get those scheduled, the visits with Kevin scheduled. The board would need to make a motion to officially appoint Kevin to agent to the Board of Health.
Okay. So I need to entertain a motion from one of the board members.
Yes.
Seeking to appoint Kevin Duquette as agent for the tobacco compliance checks.
Yes,
Lisa.
I would move to appoint Kevin Duquette as the Northborough agent for tobacco compliance.
Okay, is there a second on that motion, please?
Second.
Second from Teresa. All right, then the motion passes. All those in favor? Swati,
Yeah, I agree.
Lisa,
Agree?
Teresa,
Aye.
and myself. I agree as well. Good. That passed. Next item on the agenda, Community Naloxone Purchasing Program, otherwise known as the CNPP.
Yeah, you got that right, Glenn. So naloxone, people are most
Very
familiar with it as just Narcan as the brand name.
Okay.
But just show these screens. I think this little, infographic is pretty powerful from CDC. This states that nearly 40% of overdose deaths occur while a bystander is present. So naloxone access for bystanders can help save lives. It's a low risk high reward in those situations. And this program is funded through the Mass Department of Public Health, their substance use group department over there. It's a free program that we have some pre-approval here. We would be fully subsidized as an affiliate program. The whole goal of the program is to increase distribution of free naloxone to community bystanders. And it's not to be billed to patient insurance. So we're not collecting information. While there is a standing order for naloxone or Narcan in the state of Massachusetts for any resident to walk into a CVS and actually get Narcan, there's nothing that would prohibit you from doing that. If you can just go to the pharmacy, you don't need an order from your doctor. Some people are hesitant to because they don't want it on their medical record that they were, purchasing this product at a pharmacy, anything like that. And so these programs are great because they get it out to the community. There's a whole policies, procedures around this. There is required training, et cetera. So here's a little map, and you can see these distribution centers are really focused towards the cities and Worcester. And a lot of people will say, well, this, overdose deaths don't happen in small towns, but they do. Our rates of overdose deaths have drastically increased in the last few years. And so with our team of Greater Boroughs public health nurses, we've sort of put together this program. And the thought, here are some flyers we've drafted up. Nothing's official. The state of Massachusetts is providing us free training with health resources and action for our nurses. So the way the program, this is sort of the outline, is we would provide one-on-one trainings to residents in the Greater Boroughs region. So our 4 towns with our shared nursing staff, and individuals can schedule it. So there are groups that offer like a community training, but often for the public, there's stigma associated with this. And so you might have people that aren't necessarily willing to all be in a group with other peers or with adults or people in the community. So this one-on-one training is really powerful. And so the state will ship us the Narcan, we hold it, we follow procedures. Dr. Tennyson is signed on for the, standing order or the requirement for this. So it's a low risk, high reward. I don't think we'll have lots of takers, but this is something where the police department could go to an overdose or the fire department could go to an overdose. And they do, I think their Narcan distributions on the year, if I remember correctly, their numbers on the year were around 25 times they've administered Narcan in about a year. So it happens. It also happens, when they're not there. And so the goal is that if they go to an overdose, a flyer could be left and we'd be able to distribute this Narcan for free to our residents. So I don't know if you have more questions or you've heard about this program, but I definitely think it's really important. We have the staffing to support it. And I'm excited that we could offer something locally in people's backyards. They might not want to drive. One of our closest locations is the AIDS Projects in Worcester, and they do great work, but there's some stigma attached with going to Worcester. I mean, this idea is they call, set up a training at the health department or at the library, wherever it's convenient for them, and we'd be able to assist with distributing it for free. But there is a requirement that they'd have to go through the training, and as part of that, we would give them information on recovery resources. Okay.
Wow.
It's a cool program.
Interesting.
Mhm.
So it's not the average person walking on the street with their backpack and they loaded up with the Narcan, just looking for the poor
Yes.
soul to administer it,
Right.
right? It's normally you would have maybe a trouble, sort of potential problem in the home.
Mhm.
And you go, oh
I don't-
boy, I better
Yeah.
go get, because this is going to happen.
Right. I mean, you might have a child or a parent or a loved one or a cousin that has a history of use, and you feel safest having that available. I mean, it's so
Yeah.
effective at saving lives. Or you may work in an area like a train station, a public library. Overdoses happen in public places, and bystanders have helped to save lives by administering Narcan. So yeah, there's many different applications. Our school nurses do have Narcan. It's something that we
Yeah.
keep. Our obviously police fire, this is great. It would, get it to our nurses, and we'd be able to train everything from senior center staff or youth and family staff and be able to provide this for free. Otherwise, I believe like our police department or some other groups have had to purchase it, and it can be $25, per dose. And so this is really an unlimited free supply. We did ask some questions of the state, like, do people abuse this? What if we have someone coming in every day asking for it? And it doesn't have high street value. You know, these programs for
Right.
free distribution are available. So I don't think it's really high risk. A lot of people are hearing about the opioid settlement money, right? That's coming from all the manufacturers, opioid manufacturers. That settlement is coming. Some money is already deposited for the opioid settlement funds in Northborough, but we are not able to access those funds. And so those will be available in May, and we're working with the schools and other town departments to think about ways to use that in programming. And so this whole idea came about that when we were thinking about what can we do with opioid money, people said, well, we could distribute Narcan. And then when we looked into it further, there's a free program to do that. So the great news is we'd like to just start this now. We could keep that program going. The state just 2 weeks ago started distributing free fentanyl strips. So for individuals who are using that, if they were to have drugs and want to know if there was a chance there was fentanyl in that product, you would just, scrape the pill or whatever it might be, use the little test strip. And so we'll also include those fentanyl strips in the little pouches. We've let our fire department, police department know that those are available as well. So I think as we're seeing opioid money, the settlement funds come our way, it's also going to the state. So you're seeing some of these free state programs ramp up. So we're ready to jump on board. We have marketing ready, but I definitely wanted to make sure the Board of Health is comfortable, and Dr. Tennyson has agreed to sign on, but I want to make sure you're okay with it.
Where will the training be?
So we're HRIA, which is funded through the state to provide, sort of third party training of the trainers. So that's going to be on next week on Wednesday. So if any of you have interest, you're all welcome. So that's an in-depth 2-hour video to watch in advance and a 3 to 4 hour training. So that's a training of the trainers. So our nurses and staff will be trained. I believe individuals from Southborough Youth and Family or other individuals are going to participate in that. But then when the resident calls that number on the back of the card and says, I'm from Boylston or Northborough, I think we want to work with them where they're comfortable. I think we would find a public setting. I wouldn't want to necessarily send a nurse into somebody's home, but where are you most comfortable? We can reserve a private room at the library, or most likely the health department. We have the lab in the basement. It's very private with access. It's a private office. I think that's most likely where we'll encourage residents because it's convenient for our nurses. But I think we're willing to work with people if there's many people or the fire department. We want to make them comfortable.
Right. And then each individual is given one of the Narcan syringe or?
Yeah, it's the nasal mist.
Oh, it's the nasal.
So there's no
Okay.
syringes, no sharps or any risk there. And the state recommends you would give 2. If one doesn't work, you could administer the 2 doses. And then there's a flyer there if you need more Narcan. They would contact the health department. The state level, they don't say never give anybody more. If somebody says I live in a house and I have 6 friends living with me, 4 of them are users, I keep some in my car and on my person, like the state really doesn't want to limit it. They don't want us necessarily giving an individual 20 doses, but within reason.
Okay.
Does the state keep track of anybody who's suffered an overdose and had to be revived? Is there some database on this?
Yeah, police and fire have to track reversals, I believe is the term they use, so if they bring somebody back after administering Narcan. On our end, we are required to, track how many doses distributed, and they do ask that we inquire, but people might not want to share that information with us, whether or not there was a reversal, but there is a way to document that. So our minimum reporting requirements, we use a red cap system through the state. It's once a month we need to report how many doses are we currently holding, what have we distributed, and are there any known reversals for the doses that we've distributed. So it's pretty low requirements. The goal is to have our full-time public health nurse for the region, Erin Shanahan, now Coolard, she changed her name. But Erin, as well as Isabella, our epidemiologist, would sort of support the training and the, at least the data, the record keeping and submitting that report monthly. So they'll both be cross-trained, but it's a light lift overall. And they're both very excited about the project, as are all the nurses.
Yeah, I think so. The times they are changing. Well, it sounds, does anyone on the board have any further comments or questions?
No.
I'll take that as a no. Sounds worthwhile. How about this? The flu and the new COVID-19 booster clinics.
Okay, so yeah, we're not quite done with COVID. Let me share the screen. I'll show you the flyers. So we are offering limited new COVID vaccines. So this is the bivalent. So you might be hearing a bit about the bivalent. Just to clarify, you are no longer even allowed if somebody said, I want the old booster dose. We wouldn't actually even be able to give that, that COVID. Oh, I lost my slide. Okay, well, I'll tell you about the program because I guess it's not my little slideshow there, but it's on the town's website. We're doing 3 COVID-19 boosters. We have one this Friday that is like fully booked, last 6 appointments. We're doing about 300 doses at our senior center on Friday 9 to 12 with our SAM and VNA nurses as well as MRC. So our usual staffing plan. And so we're excited to offer that. We've definitely, Katie has been phenomenal, and Angie at patiently registering residents who are calling and having technical issues, which, you know, there's been quite a few of them in the last 2 weeks. We are fully out of Moderna. That seems like everybody wants Moderna, and right now we're sort of seeing a national shortage on the new bivalent. But we're hoping to be able to order more starting next Monday. I was on the phone with the state's vaccine unit today. We're not quite sure. And then the following week on the 27th, which is a Tuesday night, we're going to do a evening clinic at the Northborough Senior Center. We spread the word with flyers and information. We're really targeting the 12 and up. It's a 4 to 8 p.m. clinic, hoping to make it convenient for families who may have children who are doing sports or whatever that might be. So we have about half of those appointments booked, or about 300 appointments. And then we go back the next following week on Friday, October 7th from 9 to 12 again at the senior center. All of our maternal appointments are booked, but I'm hoping we'll be able to release some more. So we're continuing to support residents that are looking for help, and Katie's even helped residents find other locations if they really want Moderna and can't get in. So I can't thank our staff enough. It has been some demand for them, but for the few towns or other health agents that I spoke to that said, hey, I don't think there's a need. There's clearly a need. The 300 appointments are booked, and
Wow.
we're excited to be able to offer that locally and conveniently for our residents. So that's COVID clinics. And then flu clinics are coming too. So you'll see a similar flyer on the town's website or information under town news. That's also in the community calendar. In our flu clinics, we're doing the same model as last year. We're going to have a Saturday drive-through event. We can accommodate, we're thinking up to 500 doses on Saturday morning, October 29th. And that will be from 9 to 12 a.m. We do have registration open. Again, on town news, you can find those links. And we're excited about that, as well as a smaller clinic that is going to be offered. And let's see, that date of the smaller clinic is on a Friday, October 21st, and that's at the Northborough Senior Center. Those are morning hours from 9 to 11, so it's a little more convenient for our town employees and or seniors in town. So I've heard of a few towns not having flu vaccine, or, you know, a few nursing vendors, but it looks like we have good supply, not high dose though. If individuals are looking for high dose, they'll have to look elsewhere.
What's high dose? What do you mean high dose?
It's recommended for individuals 65 and older. In some cases, you know, not all doctors feel the same about it. So I really tell if anyone's 65 or older, I say talk to your doctor. You know, some doctors say it's not necessary. It just causes a faster immune response. But at the end of the day, you should speak to your doctor if you're over 65 as to whether or not you should get the regular dose. It is the quad valent, so it's the Fluarix quad trivalent, so it's the full protection, the 4 strains. So looking forward to holding those clinics.
Got to get your flu shot and your COVID booster. So if I go on the website for the town and navigate my way through, will it show how many openings I have left for one of these sessions?
Yeah, that's a good question. You can see how many time slots. So you'll see that there's lots of availability. So right now with our drive-through, I think we have 150 of we could go up to 500 if there's a need. I plan to order some yard signs to just put in a few key locations, probably outside the high school, town hall, just a small, just saying registered today. And the families last year was our first drive-through. People really liked it. We did 350 doses. So we want to spread the word. We're still a month out. So I'm hoping we'll get those numbers up, but things are looking good. Still early.
I'm sure I will. So as soon as the sniffles set in from the fall. Well, that's excellent. Good work. I know that's not easy. How about a COVID-19 update?
Yeah, so I will share this screen here. I'm just showing again, this is our dashboard. Our epidemiologist, Isabella, creates each week, with our updates. So, we're just really lingering. It's tough with these numbers again that we're seeing from the state are all based off of PCR, and it's really hard to know how many people are doing PCR. I would think well over 75% of people are doing antigen tests. They're not going to confirm it. It's not even necessarily recommended. So we're starting to see this dashboard is a little less useful, and we're probably looking to phase it out. We're not really seeing any upticks. We haven't had any big clusters or anything like that at the schools, not even small clusters. It's been pretty quiet and we're in pretty good shape. I think people are following the rules. Our nurses are still making phone calls to individuals, really focusing on calls anyone over 60, but we're only able to call individuals where they have the PCR test results. So there's not too many calls coming through the office. The other update on COVID-19 is the state did distribute a lot more tests. We should be getting around 7,000 more free antigen test kits. And so, this is our updated flyer. We're distributing the test kits through the health department, the library, and the senior center during regular business hours. A lot of those test kits out there, we're distributing the iHealth test kits that we're distributing from the state. A lot of those may say they're expired, but there were several extensions to the expiration dates. The kits we have now are good through at least January, maybe extended again. And the new kits should be coming shortly. So I'm hoping we'll have a robust supply to offer free kits to residents. And we're really encouraging everybody, if your health insurer is also required to give you 8 free test kits per family member per month. But it's a little difficult to relay that information because every health insurer handles it differently. Depending if you're Blue Cross or Harvard Pilgrim, you might be able to just walk up to the pharmacy desk and say, hi, here's my health insurance card, and they'll just give you the free kits. You don't have to pay anything and walk out. Other insurers require you to submit, purchase them and submit receipts. So I just encourage people in general, if you're in a pharmacy, you might want to inquire with a cashier at the pharmacy to see if you can pick up free test kits there as well. But right now we do have a really ample supply, so we're grateful to the state for sending those. We requested our full allocation. We should have them in hand. We had our fire department handing out free test kits at Apple Fest. They gave out 4 boxes, so that's about 180 test kits each. So people are still coming every day, right, Katie? There's, not as many, but people are coming to health department almost every day to pick up those kits. So we're happy to help residents with that.
Good.
So
and now you're going to have 7,000 more?
Yeah. Luckily, we took over the food bank, the old food bank in Town Hall, and we have enough storage space for it. So it's worked out well.
Hopefully the expiration date is 2 years from now.
Yeah. That's enough. Excellent. Okay, well, anybody have any comments, questions, concerns from the board? I think it was all very clear and straightforward. We have 2 meeting minutes to go over. The first one is June 14th, 2022. I was present at that meeting. Dilip was present, Swati was present, and Lisa was present. So of the people who were present at that meeting, who are also present at this meeting, any thoughts, concerns, or corrections on the minutes from June 14th, 2022? I'll start. I don't have any.
Me neither.
Good. Then I move, Lisa? Thoughts, concerns?
Yeah, no concern, nor I. Thank you.
Good. All right. Then I move that we approve the minutes from June 14th, 2022 as recorded. I need someone to second that, please.
I second it.
Very good. And all 3 of us are in favor. Therefore, they are sealed in history. The next ones are from next minutes, the July 19th Board of Health meeting. Present at that was Teresa, Dilip, Swati, and Lisa. I myself was not present. Of the board members that were present at that meeting and are present at this meeting, are there any thoughts, concerns, or change recommendations being made this evening?
No, thank you.
Nope. Swati, any changes?
No.
No. And Lisa?
No changes.
Good. Then how about somebody, I'll entertain a motion from one of the three regarding approval of the minutes from July 19th, 2022, as recorded.
Make a motion to approve the minutes from July 19th, 2022 as reported.
And somebody please second that.
I'll second.
Very good. And so all in favor, I assume Teresa,
Aye.
Swati, and Lisa.
Yes.
Those minutes are approved as recorded for posterity's sake. And well, that's what I've got listed. Is there anything else?
I have a question, and this is, not to go deep into this. Any brief updates on the restaurant situation as far as Kumar's and nothing else has really popped up since the last discussions?
No, so luckily, we're in great shape having Michael Seeger full-time and on board, and Michael is very focused and organized and out the door doing inspections. So he's going to be very caught up by September across all of our establishments. He had very positive reviews on both Kumar's as well as Casa Vallarta. So his last inspections at Kumar's were all positive. There were no concerns there. So he, we're still having those monthly third-party inspections, but Michael's in contact with their food safety consultant. Casa Vallarta, no longer has that requirement. We did receive one complaint from a resident about an out-of-date beer bottle or, some concerns that it was not clean. Michael was there that day. This is what's nice about having a full-time inspector. So he's, he follows up day of right now, which is phenomenal. We did another update with Casa Vallarta. They were doing some spraying, some pest maintenance routine, and it did set up fire alarms. So we did have a call about that overnight and out visiting that, I think, in the last month or so. But no concerns there. Michael's been impressed and is definitely following those restaurants a little more closely. And otherwise, things are well. It was very focused most recently on Apple Fest. Michael was out inspecting all of our vendors at the various events around town and positive feedback, working to hopefully have a little more efficient system of communication, moving forward for next year, because there are a lot of vendors, everything from the Tasty Northborough at Melican and Hut Holding, but everybody was very cooperative and that was a positive event. So he's staying busy, but all good news to report on the food side of things.
That's great. Thank you.
Excellent. Yeah, I've got this nifty chart that he sent over.
Yeah. I had a question regarding that food establishments. I see schools, retail, restaurant, residential. What is included in other?
I'll have to pull up Michael's report. The other, it's not, is it the temporary? What was the total number there, Swati?
It was
Temporary.
10.
Yeah, temporary was 2. Then it goes to churches. Then other is 10.
Yeah. So.
Let me, Michael, that's a newer report that he's trying to create monthly. So let me have that clarified and we'll do a follow-up email to the board on that one.
Just curious. And I didn't know there were 47 restaurants in the town.
That's a lot. I was surprised there's only 15 tobacco places. There used to be like a lot.
Really?
Yeah. Well, the whole Route 9 had all the different areas.
I think with the flavor and the vape ban, there's been a lot of, regulation around those. And so I think we're seeing an overall decrease in some of those numbers.
Yep. Anything else that's pressing?
Thank you to those of you who submitted comments on the community resource guide. So we are working on some design elements that were being added. We've incorporated edits from various boards, town departments, and we're hoping to have a final version off to the printer next week. And I'll try to give you a heads up, members, but those resource guides, that again is the Be Well initiative. Health and library are sort of spearheading that, but those should hopefully go in mailboxes within the next 3 weeks is our goal. And so we're excited to finally have sort of a printed resource that really covers a whole range of topics, especially mental health, recovery, isolation. We're working through a bunch of Be Well initiatives. Our Be Well working group, which is an interdepartmental meeting, is meeting tomorrow. We meet monthly. There's some new programming that was added, including a neat new relationship between recreation and core connection, and offering discounted 6-week programs for residents. It's $20 for a resident to try out a new 6-week class. There's a neat 5 Pillars of Health program that the library is offering with, I believe the instructor's name is Pat Doyle, if I have that correctly. But we are finally keeping up with updating our online community calendar. So if you go to the town's webpage and you click, there's tabs there that say calendar. You could go to the Be Well Northborough page. You can see the community calendar there. You can see that our flu clinics are loaded in it. Some of the classes I mentioned are there. All the Apple Fest events were entered. So we're hoping to continue to build upon that. The library and health, we've hired a shared outreach coordinator. Her name is Joanna Graham. She started about a month or so, or 2 weeks ago. It's so fast. And that position's funded half of the funding for that 1 year, 19-hour position is through our Metro West Health Foundation grant that we received, that $50,000. We bought test kits and some other things, and we don't really need to buy anything now. So we thought what we really need is someone to help with this programming, help connecting residents to resources. And the library, their board of trustees, if I'm saying their title correctly, they approved the use of the other half of that part-time position through one of their accounts. So it's not through the town budget. It's through grants and the library board of trustees funding source. So we're excited that Joanna's there. She works 19 hours a week. She's out of the library. She's helping with the resource guide and keeping that community calendar going. The community calendar also has like a form. So if a local group has a health or wellness or any sort of open community event, you can request for it to be added to the calendar. So the hazardous waste collection day is there. So other things around just general health and wellness, we're trying to make it easy for people to be able to look ahead. And we hope to continue to add programming. The Be Well group funded a teen recovery or support group. They'll be meeting at the library in the new health and wellness room they've created at the back of the second floor. Sort of towards the parking lot. So there's a lot of new programming coming your way. The goal with Joanna in the position of outreach coordinator is that we'll post a once a month list of upcoming programs on the town's website. And we can make sure to get you guys, circulate that to all of you as well. So we want to definitely help to connect residents to resources. And we have funding to provide, free programming, which is really exciting.
That's terrific. That is just.
Yeah. It's amazing.
Bravo. Yeah. Bravo.
It's a new time. Times they are changing.
It's a fun new partnership. We also were looking to apply for a new Metro West Health Foundation grant as a joint venture again to support the Be Well initiative. Really a program around health literacy is really something we're hoping to do. It's a great idea of partnering, helping residents finding reliable sources of information and other resources around that, and working with maybe our epidemiologists who can help pull local numbers on overdose or anxiety or, issues from the Youth Risk Behavior Survey data you may have reviewed on the Metro West Health Foundation website. So trying to, again, bring health and numbers and information and then use that as a tool for connecting people to available resources. So we'll apply for that and hopefully be able to report back to the board on the status of that grant application. That would be $30,000 renewable for a second year. So maybe a total of 60. And that would be around the Be Well Northborough programming or health and wellness programming. So we'll
Is
our
there
fingers
still a
crossed.
I'm sorry, is there still a recommendation box open? So if someone has
Yep.
an idea, they can just put it in.
There's a tab. So if you go to the Be Well page, there's little inputs and ideas. So we're still working through some more programming with the schools, so we're hoping the school's going to come forward with some speakers. We have some feelers out and slowly pulling that together. But yeah, if anybody knows of a program they've heard of in another town around anything health or wellness, health education, they can put that information there, and we're happy to investigate it, especially now we have an outreach coordinator. So that individual, Joanna, is there at the library, meeting the instructor, opening the door, greeting anybody that's registered, or if it's a walk-in. And it's great to have that added staff to keep those programs going.
It's really something. All right. Anything further? I have no questions. Anybody else have anything to add, take away, or address? Well, if that's that, we got to pick a meeting date for next month. Tentative future meeting date, October 18th, which is the third Tuesday now. Third Tuesday. Things are changing. All right. Well, with that in mind, I'm going to move that we terminate the meeting.
Second.
All those in favor?
Aye.
Everybody.
Aye.
Very good. Okay. Well, thank you very much. It was a good, informative meeting. And we all know where to find each other. And we'll see you on the 18th, if
Thank
not
you.
beforehand. Thank you.
Thank you. Thanks, everyone.
Thanks,
everybody.
Thank you.